Hi gang, it's Mark Thompson from Thompson Chiropractic and Superior Recovery and Performance. Today we're going to talk about part 2, lower cross syndrome, which means when I look at you from the side, there are some really weak muscles and some really tight muscles. So in your body, what that's going to turn out to be is really weak abdominal, lower abdominals, and really weak butt, okay? And the opposite of that, you're going to have really tight low back and really tight hip flexors. And that's going to either accentuate the curve in your low back and put a tremendous amount of stress on the low back, or it's going to flatten it out and tend to make the upper cross syndrome worse. It's going to pull your butt forward and your shoulders to roll in. So neither one is a good scenario. That's what we're going to work on today. So now I'm going to show you 2 versions of how to stretch the hip flexors. The hip flexors attach to your spine and the entire lumbar spine and in through the hip or the pelvis and attached to the top of the thigh. And their job is to flex the hip like this. And so if they're tight, they want to flex you forward at the waist. So 2 versions of how to stretch that. The first one, you're laying down on your bed and you shimmy over as far as you can to the edge and you drop your entire leg off. What you want is the weight of your leg pulling down, stretching this hip flexor from the top of the femur all the way up into next to my pelvic bone. And you have a decent stretch all the way up into there. So now, the more vigorous version is going to be a lunge. So if I want to stretch the left side, what I'm going to do is I'm going to take a giant step with my right foot. And I always have the wall on the opposite side of the side I want to stretch. There's a reason for that. So the first thing I want to look at is my knee position on the forward leg. I want my knee behind my foot and my ankle, because in this position there's almost no stress on my knee, but the further I go forward, the more stress there is on my knee. So what I want to do is I want to have my knee behind my ankle and foot. The trailing leg, I want my knee straight. It doesn't matter if your heel comes off the ground or not. You just want the knee straight. And then I'm going to hang onto the wall and I'm going to kind of sink down into it. And I'm going to hold my body back. And as I do, I already begin to feel a stretch right here in the bend of my hip. And the reason I have the wall on the opposite side is so now, as I'm holding my body back, I get a good stretch here. I lean toward the wall, and then I can feel the stretch all the way up into my lower abdomen. And that is the 2 stretches for the hip flexors. So now we're going to talk about a single exercise that you can do to strengthen your lower abdominals and your butt, okay? It's called the pelvic tilt, and here's how you do it. You lay down on the ground like you're going to do a sit-up with your knees bent, feet together. Place your hands on the ground, and then what you're going to do is you're going to just pick your pelvis up until it's a straight line from your knees to your chest, just like this. But at the top, you're going to purposely flex your butt so that it's nice and tight, and then you want to check the lower abs. You want everything in here to be nice and tight. So a lot of times I'll kind of poke just below my belly button to make sure I'm flexing those muscles, and hit your butt, make sure those are nice and tight. You're going to do that, and I usually come up to the top, pause for a second or 2, make sure everything is nice and tight, relax, then do it again. So you're going to do probably a set of 10 to 15 of these pelvic tilts. So that's how to strengthen your butt and your lower abs. That's it for lower cross syndrome. Thank you for watching. Thank you for liking me on Facebook and following me on Twitter. Absolutely no alcohol was used in the making of this video, even though I like to say, smack your butt.